Hey guys, so I'm back with another video. So I'm still studying for finals. I have my first final tomorrow, so I thought I'd take y'all another study break. Happy studying! Alright guys, so what we're going to be studying today is going to be cystic fibrosis. What is cystic fibrosis? It is a disorder caused by the cystic fibrosis transmembrane conductase regulatory gene. Say that 5 times fast. Or for short, the CFTR. So cystic fibrosis is a disorder caused by that gene. So this is an autosomal recessive disorder. What does autosomal recessive mean? It means that there must be 2 copies of the trait for somebody to inherit the trait. So here we have an unaffected carrier male, an unaffected carrier female, and this is their 4 options. There's a 1/4 chance the child will be unaffected. There's a 2/4 chance that it'll be an unaffected carrier, and it'll be a 1/4 chance that they are affected with cystic fibrosis. What is a carrier? A carrier is someone who has a defective and a normal copy of the gene. And the CFTR gene is important for the chloride channel, and there's a dysfunction in that with this disorder. So what kind of symptoms are you going to see? In the lungs, you're going to see excess mucus cause infection and permanent lung damage due to trapped bacteria. In the GI tract, you're going to have fats and proteins not digested properly. The mucus blocks the digestive enzymes to the intestine, which means that fats and proteins are not as well absorbed. In the sinuses, you're going to have inflammation and infection. So those are going to be your top 3. So what are we going to do for this? First things first, we have trapped bacteria. So we are going to be on some antibiotics. That's going to be dependent on the type of bacteria. And it's going to come in oral, inhaled, or intravenous. Chest physiotherapy is going to be to loosen and remove the mucus, and medications like bronchodilators, pancreatic enzymes, vitamins A, D, E, and K, which is going to be for that inability to digest fats and proteins. Those are your fat-soluble vitamins. So you'll need to take those as well as mucolytics, anti-inflammatories. With pancreatic enzymes, those need to be taken with all meals and snacks. Clinical manifestations of cystic fibrosis: salty skin, persistent cough, respiratory infection, wheezing, steatorrhea. Look that one up. ADEK deficiency, chronic hypoxia, and respiratory failure. Our preventions. They do prenatal testing, which they check placental tissue. They do a newborn screening to check for a immunoreactive trypsinogen, or the IRT, and the gold standard would be the sweat test, which measures the concentration of salt in the sweat. Diagnostic is going to be a chest x-ray, pulmonary function test, pulse oximetry, sputum culture sensitivity, and a CT scan. And just be aware that there are also other medications that are specific to gene mutation called designer drugs, and this is an example of one of those that they use for cystic fibrosis. Alright guys, do you feel like you learned something? I hope you did. I hope you learned that cystic fibrosis is a disease caused by a gene. It's going to most commonly affect your GI tract, your respiratory tract, and your, I'm remembering with you, sinuses. And what are you going to do? You're going to do antibiotics, you're going to do chest physiotherapy, which is that pounding on the back. See what I mean? Study break. So we're going to do antibiotics, we're going to do chest physiotherapy, we're going to do sputum culture and sensitivity possibly for diagnostic. We're definitely going to be on mucolytics to bring it up, to loosen it, because it's that trapped bacteria, and that the gold standard is the sweat test. And why is it the gold standard? Probably because it's the cheapest and easiest to figure out if you have it. Alright guys, I hope you learned something today. Stay tuned. See you next time. Bye.